to the 21st century. And as you can see, all these countries, that was a small briefing of the world history in less than 1 minute, okay? So what we can see here is a positive trend, an increase in life expectancy, and this increase is like more than 60 years in global life expectancy, and in global income. Global income too. If we could split, for example, some of these bubbles, China, for example, you could see that some of the poor provinces of China are around the average of the African countries. And if we can think about Shanghai, Shanghai has the same life expectancy that most of the European countries. So, what conclusions can we get around this is that with intelligent inversions in 4 topics, any country could get the results. Intelligent inversions in health, education, infrastructure, and technology. Okay, so can we start with the presentation, please? This is the digital transformation in health. Once again, it's an honor and a privilege to be here. Can we start? What are we showing? What are our global healthcare challenges around the world? We have all the reimbursement cuts. Health, it's always the most affected with government reimbursement cuts, so we have to squeeze budgets. Staffing shortage, hospital and laboratory consolidations, lack of personnel, and we have greater information to unstructured data. That is the same of having nothing. No, we have petabytes of data around the globe, but if this data is not used and is not linked directly for a clinical outcome, is the same that having nothing. So, what is happening? We are creating around the world, and Abbott and CDS is not the exception, new business model solutions that we need to use it around all the global and all the heterogeneous health systems, because as you will see in this presentation, the spending in health will increase. It's a reality, and there's nothing we can do about it. At least we think intelligent in this kind of new business model solutions, like risk sharing, pay-per-performance, bundle payments, and other structures that are working around the globe, and we need to analyze it and adapt to our health systems. So that's what I show you right now. This is what happened right now, and as you can see, the Cayman Islands has, this is an official site that I get the life expectancy around 83 years, and one of the most wealthy and high average or GDP per capita income. So, what's happening? What is the result of this population aging? This population aging, it's affecting us with the increase of non-communicable chronic diseases. If you can see these green bars here, are the bars related, what is happening with health regarding to population aging. And as you can see, the chronic respiratory diseases, and please check and keep this in mind, the cardiovascular diseases, diabetes, and chronic kidney failure appearing as a global problem in terms of mortality. When we see this data and we split it for age groups, what we can see is in global terms, this is global data extracting from the Bill and Melinda Gates Foundation, from the Health Metrics Institute. This Health Metrics Institute
Please take your seats. Mr. Chairman, I wanted to welcome the kids from East End Primary School, but it seems like
They've left,
their
sir.
time has run out. But they may be in the lobby, and I just wanted to welcome them. Mr. Chairman, I thank you for the opportunity to have a break, to huddle with the members of the opposition, all of us. It was important that we did that so that the public doesn't get the impression that we're being disrespectful to this very important ministry, because certainly we don't want it to be viewed as in a manner that it would undermine the confidence of this very important ministry. That is questions that we are asking and our interaction and scrutinizing this ministry. So I thank you for that, and we had a good discussion together, and we can now move on.
And Leader of the Opposition, I want to thank you very much for that intervention. And thank the members too. Member Minister for Health, I think you asked as well to make us say something.
Yes, thank you, Mr. Chair. I thank the members. I just wanted to give an update as we undertook to do in terms of how many persons are off training. We had one in psychiatry, one in emergency physician, one internist, one hematologist, one OBGYN, 2 family physicians. That's actually 6, and in fact it was 7 in all, but one of the family physicians declined the scholarship. And all these are at specialist level.
When we took the break, I think the member for Northside was questioning.
He's going to continue. He has other questions.
Okay.
We're okay with that.
Okay. Continue, member for Northside.
Through you, Mr. Chairman, the member and the CMO. Is there any money in this budget to develop a policy to deal with what World Health Organization has recognized as probably the biggest health crisis facing the world? There's some 50 million people have been diagnosed with dementia, and in the next 10 years expect that to go up to 80 million. And given the percentage population that worldwide, which is given as by the World Health Organization as between 5 and 8%, we should have some 400 or 500 Caymanians right now who are suffering from dementia. Is there any policy recommendations in this vote to introduce programs for service delivery, or any programs to adjust health insurance coverage to provide for the needs of our senior citizens and maybe young ones suffering of dementia? Because it wasn't given as one of the priorities by the CMO in his concerns of threats.
Mr. Chair, I'll allow the CMO to respond.
Mr. Chair, my name is John Lee. I'm the Chief Medical Officer through you. Mr. Chair, dementia is one of the non-communicable diseases and has many causes. Many of the non-communicable diseases, if you have one of them, unfortunately, you are more likely to suffer with dementia. It's a multifactorial condition and can arise from many different avenues. One of those is cardiovascular disease. which leads to multi-infarct dementia. Cineco is funded through the Ministry of Finance, and they provide considerable amounts of support through the home healthcare program in order to maintain people in their own homes rather than requiring admission to hospital. And many of the forms that I sign for home healthcare as Chief Medical Officer are for people who have dementia.
So no additional programs are planned over the next 2 years, no additional services, no discussion with the Health Insurance Commission to try and get some of the private sector people to carry some of this burden of treating these people. The ministry is satisfied that Cineco can handle it all.
Mr. Chair, through you, the management of non-communicable diseases is a pressing matter and I'm hoping will be subsumed in the program that the Honourable Minister for Health mentioned just now, that of healthcare standards. Within that, a lot of issues around standards relating to cardiovascular disease, diabetes and so forth will further help to reduce the disease burden down the line for people with dementia. So we're trying to tackle the root cause, and that is in the works now. A working party has been set up in this regard, and it includes members of the insurance community, private sector members and public sector members, both doctors, non-doctors and lay people.
And that committee is dealing specifically with dementia?
Mr. Chair, through you, no, it is dealing with the issue of dealing with the issue of healthcare standards, and healthcare standards primarily will focus on non-communicable diseases because that is something that we can certainly tackle as a country together, both through personal changes in lifestyle as well as in medication support and healthcare advice.
And what has been the response from the Health Insurance Commission?
Mr. Chair, through you, the working party, its first meeting is on the 17th of December. We don't have a representative of the Health Insurance Committee. We've invited the Health Insurance Standing Committee to send representatives, and they are sending one.
Okay. Through you, Mr. Chairman, one other question. The current acting chief officer would not have been the chief officer or the acting chief officer that developed this budget. Is that because I think she's just been recently appointed?
That's correct, Mr. Chair.
Because, Mr. Chairman, I think that's an important distinction to be made. During the last budget period, 2018-2019, the ministry undertook a consultancy to introduce a specific health insurance plan for persons over 65. Can we have an update on what was the result of the consultancy? When will the recommendations be put in place?
Mr. Chair, allow me to introduce the Superintendent of Health.
Mr. Chair, Murphin Connolly, Director of the Department of Health Regulatory Services and Superintendent of Health Insurance. Through you, Mr. Chair, the feasibility study in regards to the standard health insurance contract which was considered for the persons over 65 years of age. The study was completed, and a presentation was submitted to, was provided to caucus and to cabinet. And at this time, a decision was taken to place that study, the recommendations from that study, on hold.
How much did we spend on that study?
Through you, Mr. Chair, the study, the initial cost was $75,000.
Was there, can you give us an outline of the benefits that were recommended to be put in that package and what the recommended premium was going to be?
Through you, Mr. Chairman, the plan of benefits was actually tailored to our older persons. A survey was actually conducted through the consultants, and based on the feedback that they received, not only from those persons who responded to the survey, but also from the healthcare community, the health insurance providers, their package of benefit would have included programs and benefits specifically for hospitalization. It would also include prescription drugs, home health care, outpatient benefits, including radiology and other type of diagnostic tests. It also would have included significant care in regards to specialist services.
And was there a premium recommended?
Through you, Mr. Chairman, the premium that was recommended for that plan of benefits would have been approximately $1,010.
Was that premium actuarially calculated, or was that just a recommendation from the survey?
It was an actuarially determined rate based on the level of benefits that would have been provided under that plan.
And what limits were placed on the quantum of care that each person could access?
To the best of my knowledge, the lifetime maximum on that would have been around $2 million, to the best of my knowledge.
Mr. Chair, I wanted to go on record that what was stated by the Director of Health Regulatory in terms of the premium for the plan. We set out to try to find an affordable plan for seniors that would have an expanded amount of benefits. Because of this finding by the company, Moore & Chappell, it was a caucus decision to put this on pause because of the cost of this small pool. Hence the reason, as was discussed in this honorable house with the members in terms of investigating the possibility of national health care, which would have gave us a better result and brought the cost down per person.
Mr. Chairman, through you and the Minister, to the Supervisor of Health Insurance Commission. Do you believe that the current provision for older persons particularly those suffering from dementia, that is provided through Seneco is adequate, and is there any such coverage provided by the private health insurance carriers?
Through you, Mr. Chairman, I can say with a high good degree of confidence that the benefits that are currently covered under the basic plan would not be sufficient to meet those needs.
Through you, Mr. Chairman, has the minister, this is a different subject altogether, has the ministry's policy for MRCU in treating and fogging and etc. for mosquitoes changed?
Mr. Chair, is it possible that we could wait till we get to HES 11?
Not really, Mr. Chairman, because what we're dealing here is the policy. When we get to that, we're dealing with operational manuals and the cost thereof and how the policy is implemented. But this vote is what supposed to set the policy guidelines and the specific requirements from these departments and how they are going to function operationally and what the outputs are they expected to generate. So I need to know if there's any change in the policy at this level.
Mr. Chair, I'd like to introduce Dr. Wheeler, but I'd like the member to repeat the question, please.
Through you, Mr. Chairman, but I'm asking for a policy position. But anyway, the question is, has the ministry's policy on how MRCU is operated and what are the output expectations changed?
But before he responds, Mr. Chair, just want to note that Dr. Wheeler is only acting, and at the ministry level, we haven't changed our policy.
Okay, Mr. Chairman, I'll deal with the operational questions when we get to the vote. The other question, Mr. Chairman, and I know that we consistently find in this plan and estimates that where we have increases in the costs, there are no corresponding increases in outputs. And here we have what is a 40% increase in the ministry's vote, but the outputs are the same as 2019. I wonder if other than I think it was like 600,000 out of the 2+ million increase that was accounted for in an early answer in related to consultancies from the ministry. What is driving the additional expense if the outputs are not increased? And maybe we should ask the people who prepare the budget.
Mr. Chairman, I'm Nellie Pucci, Acting Chief Officer of the Ministry of Health, Environment, Culture and Housing. Mr. Chairman, through you, as I said before, I wasn't involved in all of the intricacies of this budget in terms of the policy, so I can't speak to the exact output numbers that are being shown and why those may be still a bit stagnant. The majority of the increase related to the mental health facility coming on stream and also the consultancy fees that we mentioned for ISWIMS. Those were the bulk of those increases.
Thank you, Mr. Chairman. I'm finished with this subhead.
Thank you, sir. Member for Georgetown Central.
Thank you, Mr. Chair. Can the minister, I think it's important before I start any more line of questioning that we address this questioning of the qualification of the chief medical officer. And the only reason I say that is because it's important for the listening audience to feel comforted that the person, and this house, the person that is in charge with advising and giving policy direction as to how to move forward about our medical system in the Cayman Islands is qualified to do the job. I'm not suggesting he isn't, but there was a question about equivalent. And maybe you can just, the minister or whoever can give the information, how the decision was made if he doesn't meet the first initial qualifications, but whatever qualifications they do have are equivalent to, and so we can clarify that before we go much further, if that's possible.
Member, I think we took the decision too that the gentleman is actually here in this house and has been as well. We suggested at that time that we should wait till the Deputy Governor was here to try and deal with these questions that you all may have with regard to it. I don't think it's proper for... So I would prefer that we just leave the HR matters and deal with them at the appropriate time with the Deputy Governor who's head of the civil service. Okay, please.
Mr. Chair, I will respect your decision as you're the chair, but I want it to be noted in the record that I'm concerned that I cannot ask the relevant questions without that answer being answered. So let it be noted.
Yeah.
I'll move on to a different question. Can the minister say whether he was consulted on a decision by the HSA to make the security staff at HSA redundant before Christmas?
Mr. Chair, I try not to get into HR matters, but any major decision that any of the entities make, they always consult with the ministry.
Thank you, Mr. Chair. And maybe I should rephrase the question. You're right, Minister. They don't consult directly with the minister. Can the ministry head say whether they were consulted about this important decision?
So, could the member be a little clearer?
Can the ministry, by through the chief officer, say whether the ministry was consulted about the decision to make the security staff at the HSA redundant before Christmas?
What I can say, Mr. Chair, is that we were alerted of the concern that they had with the security staff. And as we are quite aware, this is a case ongoing in court right now, and it may be sub judice. But So I'm trying to understand when it is that you're talking about now, or you're talking about the initial investigation or discovery.
Thank you, Mr. Minister. Through you, Mr. Chair, I'm talking about the decision that the HSA has now taken, excluding those persons who have been charged. We're not talking about them, but the ones who have been freed from any wrongdoing have been made redundant. Was the ministry consulted about that?
Mr. Chair, what I can say to the member at this time is that, as I alluded to earlier, that this matter was brought to me in the initial stages and in the latter stages at present about decisions that they were making at the board level and at the HSA. Once I was advised of some of the possible decisions they wanted to do with some of the staff. I advised them to get legal opinion that I couldn't give the consent to what they were attempting to do until legal was happy with what they were doing.
Thank you, Mr. Chair. Can the ministry then say what they have attempted to do and explain what has actually happened, so the listening audience knows what happened to the Caymanian security guards at HSA?
Mr. Chair, I'm being cautious, and the CEO is here and can speak to elements of this matter, and but I'm sure that the members realize that we need to be careful and cautious in whatever we do in here, and especially this matter. A portion of it is within the courts, so I'll allow her to say as much as she can to try to give this this honorable house an update on this matter. Please give me a few minutes. Mr. Chair, I wanted to introduce the CEO of the HSA.
Lizette Yearwood, Chief Executive Officer of the Health Services Authority. Mr. Chairman, through you, in keeping with our strategic plan, the board has been exploring various ways to collaborate with the private sector to improve efficiencies, to reduce cost, and to improve operations. So whereas I concur with Minister's position in that any personnel matters we would refrain from dealing with, but I think this is more of a strategic policy matter. So I will outline the operational aspect of it. So in order to ensure that we can focus on our core business and continue to improve the quality of patient care, the board in general has been exploring ways to collaborate with the private sector to ensure efficiencies. So in accordance with the E&Y report that was commissioned by government some years ago, the board has made a decision to outsource the security services, and just as we have done earlier in the year with the outsourcing of our debt collection. And we are sensitive to the potential impact that it will have on the affected officers. However, we're doing everything that is practically possible in order to assist them to get another job, whether it's inside of the organization or outside of the organization. And this includes things such as assisting them with resume writing, providing references, introducing them to the work agency, and professional services that will assist them with this transition. In addition, we are offering them a separation package which will assist them in the transition period. And we've gone a step further actually to make a decision that, you know, with the outsourcing of this service, we will actually incorporate aspects of the RFP that we'll put together to ensure that there's a specific criteria that's developed in the public tendering process to ensure opportunities are provided for Caymanians in that service.
Mr. Chairman, just interjecting.
Member for Bodden Town West.
Thank you very much. I am curious then, Mr. Chairman, if this is a standard strategic decision, why then are the affected staff asked to sign a compromise agreement and also asking them to require them to tender their resignation? This sounds a little bit different in terms of what the letters that the staff received. So I would really like to have an explanation explaining if that is the case, why then are they asked to resign and also to sign a compromise agreement?
Mr. Chairman, through you, we did seek legal advice in this matter, and this is a separation package that was offered to them as an interim prior to going through the redundancy process. So they have an option to take the separation package. If not, we will continue to go through the redundancy process and take it through the step-by-step that has been outlined.
Thank you. Through you, Mr. Chair. As far as I understand, the definition of redundancy, meaning the position no longer exists. So if the position no longer exists, but you're outsourcing it to get it from a company that most likely will not have Caymanians doing the job, how can you be making them redundant?
Mr. Chairman, through you, the redundancy definition means that the organization does not have that position, that post on our books, but it doesn't mean that you can't provide that service through an outsource, through a private agreement outsourcing it. And this is in keeping with legal advice that we received.
Thank you. It sounds like we need to change our laws in this country, but Mr. Chair, through you, can you outline what securities that you intend to put in the RFP to mandate that the people who are hired are Caymanian?
Mr. Chairman, through you, again, what I had said earlier is that in developing the RFP, we will ensure that there's a criteria. So those vendors who are tendering for the process will be given higher scoring if they are employing Caymanians to do the job. This, in essence, will be an incentive for them to perhaps hire some of those redundant officers. And in addition to that, we're looking to see if there's opportunities within the HSA, other opportunities within the HSA that their skill set would fit.
Through you, Mr. Chair, are you aware that this legislative assembly is actually trying to do the opposite with the government building right now, where we're trying to change the officers who come there who are non-Caymanian to Caymanian, but HSA has made a decision to go in a totally different direction? Do you recognize that's what's happening?
Mr. Chairman, through you, I'm not privy to the policy decisions that is being made to affect the security officers that's hired within the admin building. However, it has been a policy decision of our board to outsource the service, and they are sensitive to the fact that we do want these Caymanians to get jobs, and that's why we're doing everything possible in order to assist them to transition to another job, whether it's within the organization or outside of the organization. And we are incentivizing those companies that would, in essence, apply for the contract to hire Caymanians, therefore hire some of those same Caymanians.
Thank you. Can you finally, can you say in respect to this matter, this was a board decision, correct?
Through you, Mr. Chairman, yes, that's what I said in the beginning. This was a board's policy decision to outsource the service.
Thank you. Can you say to this honorable committee how the board is selected?
All boards are at the pleasure of the minister or by cabinet.
Thank you. Through you, can you say that the main reason for this decision was based on cost?
Mr. Chairman, I outlined in the beginning through you that this was in keeping with our strategic plan to explore ways to collaborate with the private sector to improve efficiencies, reduce costs, and to focus on our core business. Security services is not the core business of the HSA, and therefore in these times we have been challenged with keeping them skilled to the point that they're able to mitigate some of the security risks that we're seeing within the hospital environment. And certainly if we are outsourcing the service to a company that is specialized in this profession, then they will be able to keep them skilled and equipped to be able to keep up with the challenges that we're seeing throughout.
Mr. Chair,
You're giving way to the Leader of the Opposition?
as long as I can get back to the other questions.
Go ahead with your question, Leader. You okay?
Thank you, Mr. Bryan. Mr. Chairman, I've listened here quite intently, and I seem to be getting confused. How long has the HSA been employing its own security officers?
Mr. Chairman, through you, the HSA has employed security officers for as long as I've been with the organization. But once again, what I've said to the Honourable House is that the board has been tasked with exploring how they could ensure efficiencies so that we can focus on the core business of the organization, which is providing quality health care to the people of these islands.
Yeah, I'm coming to that one too. What prompted that? In that specific area of the strategies?
Mr. Chairman, through you, once again, this is a strategic position that the board has been taken, and this is not the only area that we have looked at outsourcing services. As I said at the beginning of the year, we've been outsourcing our bad debt collections, and this is just a follow-up to that. So it has been a strategic review throughout the organization.
Mr. Chairman, I wonder if, and I know she's speaking on behalf of the board here, but certainly it should be noted that if not, we should get the chairman of the board. Where are they? No chairman? Okay. I guess we're all on the same hot seat then. without the real person. If the board has developed strategies, it would be interesting to see when those directives were developed, because it appears a little unfair or ominous that after an incident occurred, we now have a strategic directive to outsource that particular service for the HSA. But more importantly, those who were at the bottom of that totem pole within that section of the HSA are being penalized. The impression is that they're being penalized because 2 or 3 of them have now gone off to be charged in the court of law. And it seems rather unfair that career Caymanians are being put out of work, and we're going to outsource it with a caveat that they got hire Caymanians when we had Caymanians there. Has the board considered that?
Mr. Chairman, through you, the board has strategically considered this decision, and once again, the management of the security officers is something that will be outsourced to the private sector, who are experts in this area. At the HSA, our core business is healthcare. So with these developing security challenges that we're seeing throughout the country, we are not in the position to be able to focus in that area sufficiently. So we feel that if we outsource to the professionals and incentivize them to hire Caymanians, we then will be able to have a win-win situation.
If we're going to incentivize them.
Member from East End, I don't want to disturb your question, but it's about the 3rd time I've heard literally the same question asked, just phrased a different way. And I think we've gotten the answer. So if we could, move on from that, and let's try to get some of the other questions here that you may have.
Okay, Mr.
Just trying to move things along here.
I bow to your role, then, sir. If we were outsourcing it, and these security officers it is agreed that they were good security officers, at least they weren't corrupt, or they would be under criminal charges. Why is it that the HSA board did not insist that all of them be rehired under the management of the private sector management?
Mr. Chair, I would have to humbly say that we can't instruct a company to hire anyone. It would be an incentive, and it's nothing less than what the whole House approved through the member from Bordentown West. Same strategy in trying to ensure that Caymanians were given opportunities at government buildings and ports and other government entities. But we all knew that there was an element, a certain percentage that would have to be outsourced because our people just don't do certain elements of security. I mean, that was determined and passed unanimously in this House.
Mr.
Sorry, I just want to make a comment here. My motion was designed to give Cayman opportunities. This process actually took away opportunities that existed for Caymanians already to put them, to basically give, to avoid the situation that we're trying to. So I just want to be clear with that one.
No, you can't say that, Mr. Chair, because you don't know what the RFP says.
But no, what I want to make clear is that Caymanians already have this opportunity. So that's what I just want to make clear.
Okay.
So we're not looking to take away opportunities that Caymanians already have.
Member from East End, you do have the microphone.
Thank you, Mr. Chairman, and I thank my colleague for the intervention. Was it not considered a possibility of hiring a head to manage, how much are they, 10, 12? To manage the security that was in place? As opposed to making them redundant. I know, I understand you saying you're in the business of healthcare and providing healthcare services. But we also agreed that it has been there for many years and it was being operated efficiently. Why didn't we, or did we consider that?
Mr. Chair, I don't want it to be said or the listening public to ever think that this minister would do anything untoward that would make it unfavorable or uncomfortable for Caymanians being hired. This government supports any opportunity for Caymanians to be hired. The situation at hand was investigated by the board, and whatever findings they came up with, they decided that this element of business for the HSA would be too tasking to continue, and they wanted to handle it in a wanted the HSA to handle it in a different manner, from what I understand and from what I've been briefed.
Mr. Chairman, just let me finish off, because obviously we're not going to get the answers we want. We're going to get the line that the narrative that has been developed, and that's fine. I'm okay with that.
And remember, I think too, we have strayed beyond policy advice as well into specific operational issues as well.
Sorry,
I'm not stopping
Mr.
you from
Chairman,
making
this
those
vote also
interventions.
deals with governance. This vote, if you look at the output, it deals with governance, and this is governance related. So this is not just policy alone, this is also governance.
I know, but what I was going to suggest to members is that if we could take the vote on this and pick it up the discussion elsewhere in the operational sections.
Mr. Chairman, I believe the members are chopping at the bit. So let me get out of the way, because all I do is cause problems, it seems. But just to say, Mr. Chairman, while I respect your ruling that, I believe still that an authority being an entity of government, sole owner, government being the sole owner, there are provisions where the minister can give general direction to those authorities as the representative on behalf of the ownership. And that is how this falls into policy as to whether or not the political directorate has given a policy directive to one of those authorities or government-owned entities. So basically that's where I'm coming from. But my own other question is, what other services are we outsourcing, and will they be asked to ensure that it's Caymanians as much as possible? And if we are going to put a percentage on them of how many Caymanians must be employed at HSA under their membership. Say we expect you to have 70, 80%, or whatever the case may be.
Mr. Chairman, through you, to the member, that's exactly how the RFP will be constructed. It has not been completed as yet, but that's exactly what we're going to look at. So there's a criteria that will be put in place so that it will incentivize them to hire Caymanians, because they will score higher if they have a certain percentage of Caymanians that is employed within the company.
Mr. Chair.
Member from Georgetown Central, come back to you.
Thank you, sir. Can the minister say, did the cabinet agree or give approval to the board's decision on this matter?
answered that earlier, Mr. Chair, in terms of that we sent it to legal.
Mr. Chair, through you, maybe I can rephrase the question again. I'm asking the minister, when he was made aware, did he take it to cabinet to seek approval on this board's intended decision?
Mr. Chair, while the Honourable Minister's consultant, may I attempt to assist the Honourable Member from Georgetown Central and the wider public? The HSA and other government authorities an independent organization. As was said by the Honourable Leader of the Opposition, the Minister can give general directions if it's so specified in the relevant piece of primary legislation, but there is no provision, as I understand it, for a requirement mandating the Minister to go to Cabinet to get permission. The Minister, at his discretion, based on the importance or the relevance of a particular situation, can so inform by a Cabinet note if that is desired, or when there any other business that arises on the agenda, ministers can inform the and the Minister can answer specific. That was just generally the modus operandi of a board and Cabinet.
Thank you, Minister, for the intervention.
Thank you so much, Madam Minister, for that intervention. But since you used the word general direction, can the Minister say that he give any general direction to the board as to this decision?
Mr. Chair, the government is just as concerned as the opposition in terms of Caymanians losing jobs. Obviously, I was concerned when I saw it in terms of the decision that the board had came up with. And my response to them was to ensure that the Caymanian element was in there, whatever we did. And we must respect that even if it's a private security company, it's owned by a Caymanian. And that legal gave its blessing, and and to rethink and to ensure that they had all the supporting documents and information of why they came up with this decision. So I wasn't comfortable in moving forward without legal's opinion.
Mr. Chair, I want to start to wrap this up now and get away from it. So I'll ask the last two questions and then move on, because I don't think I'm going to get much further. But the Minister just said, to be mindful that the company is also a Caymanian company. Is the Minister already aware of which company is going to be selected before the RFP is finished?
Please don't be silly in this house.
Mr. Chair, is that an answer?
I'm sure that the member knows that the companies have to be owned by Caymanians.
Okay,
it's not the company's law.
Thank you for the clarity. Sorry, Minister. Can the chief of sorry. Through you, Mr. Chair, the CEO said that the HSA is not in the business of security and they offer medical services. And I agree with you. But neither you in the business of accounting or cleaning services or IT. Should the people who work at HSA be concerned that they may be outsourced as well in the effort to do savings?
Mr. Chairman, through you, once again, this was a strategic policy decision based on ensuring efficiencies and reducing costs and improving our operations. And at this time, there is no further intent for any other redundancies or outsourcing of services at this time. However, once again, I want to refer you back to the E&Y report that was done as a result of the core government's request some years ago, which did identify that there could be efficiencies that could be engaged within government and the statutory authorities by outsourcing these services and by working together to be able to outsource these services to enhance the core operations.
One final question, members, you indicated.
Thank you, member. I want to go to a different area and just in respect to the policy drafting. That's why I want to move off of the HSA. Can the minister say if has there been any drafting or policy considerations to mandatory recycling by households and businesses?
This is not a mandatory policy.
Sorry, Mr. Minister. Sorry, Mr. Chair, but I'm kind of confused about the answer when he said this is. I'm not speaking about the HSA anymore. I'm now speaking about waste.
I answered what he asked. We were on a different subject. He asked about recycling, and this is not a mandatory policy.
Okay.
We would
I think we've got that clarified.
We would love to get to that
member
point.
No. Okay, so member for Newlands.
Thank you, Mr. Chairman. Just briefly going back to the redundancies. Did I hear correctly when the CEO said that these individuals are going to be made redundant, however, they were offered the opportunity to resign?
Mr. Chairman, through you, this was an interim step to the redundancy process. Our redundancy policy at the HSA takes specific steps, and we are ensuring that we go through each one of those steps in its entirety in order to outsource that service.
But then wouldn't telling someone that they could resign conflict with the whole notion of redundancy? Because in resigning, the employee is giving up their benefits, they're giving up severance, they're giving up a lot of benefits, really.
Mr. Chairman, through you, I did identify that we are also offering a separation package which outlines all of the details, including severance, and in fact, we have gone a step further to offer things that is not actually a requirement of the law.
Well, I'll just ask this, because I don't want to delve into this much further, Mr. Chairman. Has all the legal advice given surrounding the situation, has any of it indicated whether or not going that route could be interpreted as constructive dismissal?
Mr. Chairman, through you, as I said, we're following all the legal steps and ensuring that we follow the process as well.
Well, I just wanted to clarify that. Has any of the legal advice given pointed in that direction or given some warning that that could be a potential result?
Mr. Chairman, through you, legal advice is privileged, and I wouldn't want to go into the detail of the discussions that we've had with our legal representative.
Members, I'm going to put this vote to the court, put this unit to the. We've been at this for more than 2 hours, sir.
Mr. Chairman, well, if you allowed other members to think that and you didn't stop them.
All right.
But
Members, it is 1:15. Let us take a break for 1 hour for lunch.
Yeah.
Okay?